Hi, my name is Arielle, and I'll be your nurse today. Can I have your name and date of birth? Thank you. So, your chart shows that you're on our unit today because you just had a surgery on your brain for a left side ischemic stroke, which means on your left side you had a block that was not allowing blood and oxygen to flow to your brain properly. So, because it affected your brain, we're going to do a neuro assessment on you today. And I'm going to start with some questions. These questions will help us determine how alert and oriented you are. So, your first question is again, what's your name? Okay. And do you know what the year and the month is? It is August 2025. Do you know why you're here? Because you had a surgery, yes. And do you know where you are? The hospital. So now I'm going to move on to your eyes. I'm going to shine my pen light into your eyes just to see if your pupils get smaller as the light shines into your eyes, and they do. With the same pen light, I'm going to need you to stare at my nose, and I'm going to bring this pen light to you to see if your eyes react, and they did. And now I'm going to test a few of your cranial nerves. Those are nerves in your brain that control face and, movement and stuff like that. So with the same pen light, I'm going to go into 6 fields. Diagonal up, diagonal down. And I want you to follow this light only with your pupils, not your head. So diagonal down, diagonal up, up. Awesome. And your eyes follow perfectly. Now I need you to raise your eyebrows and close your eyes real tight and smile. Frown. Stick your tongue out, wiggle it side to side. Press against my hand with your head and shrug your shoulders against mine. Yes, my hands. Awesome. So I do notice still a little bit of facial droop. Other than that, all cranial nerves are intact. And now I'm going to test your strength. Can you squeeze my hands as hard as possible? Awesome. I'm going to push down on your arms. You push up on me. I'm going to push up on your arms. You push down on me. I'm going to push you in, push out towards me. I'm going to pull you in. You push in. Pull in. Yes. Now with your legs, same thing. I'm going to push down. You push up. I'm going to push up. You push down. And with your feet, I'm going to push towards you. So push like a gas pedal. And then I'm going to pull on the back. You push towards my hand. Yes. So it looks like your strengths are all there, although your right side is weaker than your left side, which we would expect in a left-sided stroke, because when anything affects the left side of your brain, it comes out as the right side of your body. Yes. And so now I'm going to test your coordination. I want you to touch your nose and then my finger, touch your nose and then my finger, touch your nose and then my finger, and then with your other hand, touch your nose and then my finger, touch your nose and then my finger, touch your nose and then my finger. Awesome. So your coordination is intact. Now I'm going to stroke your arms, both of your arms at the same time with an object, and I want you to close your eyes and tell me if it's soft, dull, or sharp. And I want you to tell me if there was less sensation on one side. So here's my first object. And you said it was soft and there was less sensation on your right side. Yes, that was my cotton swab. And you said less sensation on your right side. Again, second object. And you said it was sharp, but you had less sensation on your right side. Okay, that was definitely my sharper object. And now on your legs, you said it was sharp with less sensation on your right side. And my second object, soft with less sensation on your right side. Yes, that was correct. Okay, so now I'm going to have you hold your arms out like this and close your eyes for 10 seconds. And that just assesses to see if you can hold your arms or if there's still a droop there. And I do see your right arm starting to slowly descend as you try to hold that up. And again, with your legs, I just need you to hold your legs up, close your eyes. And I do see that right leg again descending as we're talking. So based on my assessment, oh, also, do you have any pain right now? Okay, pain at your surgical site, any nerve pain? All right, so I'm going to look in your chart to see if you have any as needed medications due right now, and I'll bring that in for you. Do you have any vision changes? A little blurriness? Okay, so yes, upon my assessment, I will go ahead and chart that you are having a little bit of blurriness, vision changes. You have a little bit of pain in your head at your surgical site, no nerve pain. Cranial nerves are intact. There is a slight droop on your right side of your face. And for your strengths, you are experiencing weakness on the right side, as well as diminished sensation on that right side. But your coordination is intact. So I'll go ahead and check those medications for you. Do you have any questions? Alrighty, I'll go ahead and let the doctor know. He'll review your chart, and if we have any further plans, we will come and talk to you. We're more than likely going to consult with PTOT with the weakness of that right side, and also just trying to get you back to your regular, close as possible to your baseline of activity of daily livings, like activities, walking, bathing, cooking, and stuff like that. So we're gonna get PT and OT in with you as well, so we can coordinate some more care for you. All right, if you have any questions, here's your call bell. You just hit the red button. My name is Arielle. Thank you.